Hello everyone, I'm Dr. Monica. Today's video will be on Lamina Dura. So with the help of this diagram, let's understand the anatomy of Lamina Dura. So this is a tooth socket inside which a tooth lies in its position. So surrounding this socket lies the alveolar bone. So it has outer socket wall and inner socket wall. So the inner socket wall of each teeth, which is made up of thin compact bone, it is the alveolar bone proper. And this alveolar bone proper, it appears as radio-opaque line radiographically, and it is known as lamina dura. So basically, lamina dura, it lines the tooth socket and it is located adjacent to the periodontal ligament. So with the help of this diagram, let's understand the bone components around the tooth socket. So the facial and the lingual portions of the socket, they are primarily formed by the compact bone. Whereas in the apical areas and the apicolingual areas and in the interradicular areas in the multi-rooted teeth, we can see the presence of cancellous bones. So the lamina dura, it represents the cortical bone lining of the tooth socket. Histologically, lamina dura is also known as Cribriform Plate, and it has small openings that allow nerves and blood vessels to pass between the pedial and cancellous bone of the alveolus. So the transalveolar vessels that branch from intraseptal vessels pierce the lamina dura to supply the periodontal ligament. So coming to the radiographic characteristics of lamina dura, on X-rays it appears as a continuous radio-opaque line that outlines the root of the teeth. So its appearance, it can vary due to the shape and position of the tooth root and changes in the X-ray beam angulation. So a clear intact lamina dura often indicates healthy supporting bone and normal periodontal status. Radiographically, lamina dura helps differentiate conditions such as periapical cemental dysplasia, condensing osteitis, and focal periapical osteopetrosis from hypercementosis, in which it surrounds the affected area just like in the normal cementum. Few conditions in which we can see loss of lamina dura, which includes giant cell tumors in the jaws, hyperparathyroid bone disease, Paget's disease, fibrous dysplasia, and osteomalacia. So let's understand the influence of technique and pathology on lamina dura appearance. So in cases of incorrect horizontal angulation, it can lead to tooth overlap and it can distort the interdental bone image, and also it alters the width of the pedial space and also the appearance of lamina dura. So a break in the lamina dura with apical or lateral radiolucency, it often indicates chronic or acute pulpal infection. So lamina dura and pedial changes in occlusal trauma. So trauma from occlusion may cause widening of the pedial space, thickening of the lamina dura, especially along the lateral root surface and in the apical and bifurcation regions. So during the injury phase, there may be loss of lamina dura in apices, furcations and marginal areas. So loss of lamina dura, it leads to widening of the pedial space. So let's see what changes are seen in lamina dura in periodontal conditions. In periodontal disease, the interdental bone shows altered lamina dura and there is also decreased crestal radiodensity. The earliest radiographic change which is visible is the fuzziness and disruption of the crestal lamina dura continuity due to the bone resorption. Intact crestal lamina dura may suggest periodontal health, but its absence alone is not a reliable diagnostic indicator. So lastly, key points to remember, lamina dura is the compact bone lining the tooth socket, appears radio-opaque and continuous in healthy bone. Interdental septum, it provides the structural support between the teeth. And the radiographic evaluation of the lamina dura and pedial space helps differentiate the normal anatomy from the pathologic changes. If you have liked the video, please like, share and subscribe to this channel.